Good evening, Assalamu alaikum rahmatullahi wa barakatuh, and welcome to News in Focus. My name is Faraz Patel. We'd like to thank you, the viewer, for staying with us on Hilaal TV on DSTV channel 347. On Friday, it was declared from an official perspective that famine is now occurring within Gaza City and the surrounding areas. The Integrated Food Security Phase classification had previously warned that the enclave was on the verge of famine, but now says for the first time that the events over the past few months, including the Israeli offensive, increased displacements, and week of total Israeli blockade of the territory have made famine a reality in Gaza. We saw what happened yesterday. More journalists were being murdered, and many residents within the enclave are still being denied food. Human rights groups, every report has pointed out of violations of international law that Israel is committing. Joining me now, I'd like to welcome no stranger to Hilaal TV, Jonathan Fowler, who comes to us from Amman. He is the spokesperson for the United Nations Refugee Works Agency. Jonathan, always good having you on. Thank you so much for joining us.
Thank you for having me on the program again.
Jonathan, this is a rhetorical question, but I think for the viewers out there to maybe get to where we are right now, how did we get to famine being officially declared in Gaza? Again, I say it's a rhetorical question because I think many of us knew this was a long time coming, probably 2 or 3 months ago. But from an official IPC classification, how did we get here?
Well, yes, I mean, the total blockade on humanitarian aid from the beginning of March through to May, I mean, that's the major contributing factor that tipped the population into full-blown famine. I mean, you know, famine is measured in certain ways. For example, 20% of households are facing an extreme lack of food, more than 30% of children malnourished, and 2 adults or 4 children in every 10,000 people dying every day. Now, you know, once that happens, that's why it's possible to confirm a famine situation. But, you know, everything leading up to this, I mean, the total ban on aid, and then this kind of slight sort of lifting of it in May to allow a trickle of aid in, far insufficient from what's required. But, you know, we also need to set this in the wider context of what's been happening since October 2023, which was, you know, there was a sort of shorter blockade on aid, and then a bit was allowed in, and then during the ceasefire, some was allowed in. So people's ability to cope has been tested over and over and over, and it's just got harder and harder for people who've been displaced multiple times and have lost all access to food supplies to survive. It's as simple as that. And this is man-made, of course. This is not a natural disaster. This is not the result of a drought or something like that. This is about a choice to deprive a population of the means to survive.
Here's the thing, Jonathan. So waiting right now, there are, of course, a lot of border gates. The two that I want to focus on is obviously the one in Netzarim and in Rafah. They are close to, if I stand to be corrected, and you'll be able to correct me on this from a United Nations perspective, there are at least over 1,000 aid trucks that are waiting for that to be crossed. Some have been allowed in, not all has been allowed in. How much has that contributed, Jonathan, to this official declaration of famine? Because if you listen to if you read every United Nations report, they say the same thing. It's not enough.
Precisely. I mean, you know, allowing just a trickle of aid in, you know, that has sort of inexorably driven the Gaza Strip towards famine. And, you know, currently there's famine conditions in Gaza City and the surrounding areas, but there's a very real risk that if there isn't a massive change soon and a huge spike in aid flows, that the famine is going to spread further south. You know, including to sort of the zone around Rafah. And this, you know, this is an appalling prospect. But precisely, I mean, you know, you have an insufficient number of places that aid can come through. You have incredibly cumbersome restrictions and inspections, you know, rules that change from one day to the next. I mean, we as the humanitarian community face this from the beginning of the war. You know, these sort of very sort of heavy-handed ways and controls placed on what could come in, and the amounts being restricted, the limited number of border crossings, all of these things. So it's a web of factors that have led to this horrific situation, which, as I said previously, and I'll emphasize again, this is man-made. There is no question about that. There's nothing natural about this at all. This is deliberate starvation.
Jonathan, when you see the crowds going into these aid sites, how much has that, because I've obviously had time to read this integrated food security phase classification. One of the parts of that report, that when you have thousands of people running to these aid sites, and the word that is being used, desperation, that in itself has to equal famine, doesn't it? The fact that food which cannot be received as normal humans would receive it, as probably someone like you and I would receive it where we are right now. The fact that it has to be done in a way where it's being done in a desperate manner, that also, Jonathan, has contributed to this classification of famine, hasn't it?
Absolutely, absolutely. I mean, this is an important point because, of course, since the sort of partial lifting on the ban on aid coming in May, there's been a focus by the Israeli authorities on working through this so-called Gaza Humanitarian Foundation, which is, this Israeli-American scheme, very, very militarized, insufficient number of aid distribution sites. People have to go to these sites to collect aid. They're very far often from where people are located, and people have been killed in and around these sites. So I mean, this is perfectly shocking. Hundreds and hundreds of people who have died, been injured. So people are laying down their lives in a desperate attempt to get food. Now, the point about this is not how humanitarian operations are supposed to work. The point about humanitarian operations is they go, aid workers go to where people are, people in need. I mean, that's what we do, the UN system does around the world. And we've not been allowed to do this within the Gaza Strip. This means that people have to kind of go into these death trap zones, and there's only a handful, like half a dozen of these sites where aid is distributed, unlike the several hundred aid distribution locations that the UN system was able to run primarily through UNRWA during the ceasefire period, for example. So this is all about choices to not allow certain things to happen, and the things that need to be done in order to keep the population alive.
Okay. Before we go to the break, Jonathan, you've of course mentioned UNRWA has not been in Gaza. It has been there, of course, not just before October the 7th, but it's been there obviously for quite some time, 2 decades to stand to be corrected. And within that 2 decades, of course, there has been blockades, many of them being minor, but of course we've seen major blockades that have been occurring, obviously since October the 7th and now since March this year. When you compare the 2 phases of these blockades, I beg your pardon, looking at how famine has been conducted, talk to us about really the devastation that Israel has created in order to make sure that we are where we are right now in Gaza.
Yes, I mean, thank you for that question. So yes, for the context, for your and your viewers' context, we've actually been working in the Gaza Strip for many more decades. I mean, our mandate, which was given to us at our point of our creation by the UN General Assembly in 1949, was to provide relief and services for Palestine refugees in 5 specific places. So Jordan, Lebanon, Syria, the occupied West Bank, including East Jerusalem, and the Gaza Strip. So we've been, standing with the population, providing relief, work, services for the Gaza Strip for decades. In our photo archive, you have pictures of people sort of pitching tents on the sand in the late 1940s, early 1950s, after being driven from their previous homes in what is now Israeli territory, and trying to rebuild their lives. Now, you did indeed flag that the Gaza Strip has been under a tight blockade for a couple of decades, and so that has left a lot of the population living in poverty, reliant on sort of social services, as it were. And so we've continued to do our work, but clearly the situation since October 2023 is unprecedented, because not only have more recently the total ban on aid, but we we sadly, tragically, indeed, we've had over 360 of our staff killed in the Gaza Strip. That is entirely unprecedented in the history of the United Nations for so many United Nations staff to be killed. And that's absolutely shocking. All of those staff are Palestinians. UN operations generally around the world rely on local people primarily. In any case, but we've had colleagues who've died along with their families. We've had colleagues who have been killed in the line of duty. We've had colleagues who've been detained, mistreated, tortured in custody, all of these things. But we have continued to do our work. We continue to provide, for example, around 14,000 medical consultations a day, even though our number of our clinics, has reduced. We're trying to do sort of basic education for as many children as we can. It's in the several thousands, nothing compared to what we should be able to do. We continue to work. So even though we are banned from bringing in any aid by the government of Israel, we're continuing to work on the ground. We remain the backbone of the international humanitarian operation. But it is, of course, incredibly challenging, first and foremost, for the colleagues who are trying to do the work on the ground. They're as hungry as anybody else. Sure. And we have colleagues who are fainting when they're trying to do their job, and yet they continue to do it.
After the break, my conversation with Jonathan Fowler continues. We're going to be asking this question. How has this violation of war crimes occurred by Israel? Do stay tuned. Welcome back. I'm still in conversation with Jonathan Fowler, who's the spokesperson for the United Nations Refugee Works Agency. Again, Jonathan, thank you so much for staying with us. Jonathan, I want to talk on this Gaza Humanitarian Foundation. Obviously, since its inception, there's been a lot of controversy with regards to it because on one hand, there is aid that's occurring, but on the other, there seems to be mass killings that are going on in these aid sites. Listening to the testimony of Anthony Aguilar, who was a U.S. contractor, when he spoke about the story of that little boy, Amir, who, of course, just wanted to get flour for his family and ended up being shot dead. How has this GHF, from an UNRWA perspective, really become a tool of death and in the way it conducts its work, and yet still is operating within these certain parts of the aid sites?
Yeah, this is a very important issue. We and the rest of the United Nations system, and indeed other humanitarian actors from around the world, had repeatedly warned when this idea of this Gaza Humanitarian Foundation was first raised, that it was not going to be doing the right thing because it's militarization, it's involving party to the conflict, all of the things which go against basic principles of international humanitarian law. Now, this isn't just us saying this, because in fact the original CEO of the Gaza Humanitarian Foundation, he actually quit on the eve of it beginning operations in May, and he said he couldn't stay with it because it wasn't in a position to guarantee respect for neutrality, independence, impartiality, and indeed humanity. Now, it's but somehow been framed by the Israeli authorities as a solution to a problem which was supposedly diversion of aid by Hamas and other armed groups. There's absolutely no evidence for that. And indeed, for members of the previous US administration have gone on the record as saying that in private conversations, indeed, with Israeli officials, this was never raised as a concern. So this is a concern that's raised in public, and then along comes this Gaza Humanitarian Foundation as a so-called solution, and it's simply so that in itself is fundamentally flawed. But it's operations on the ground, and you've cited the statements by the whistleblower and other people about what has allegedly happened there. I mean, it's been seen over and over that people get killed when they are trying to get to these few sites to receive aid. It's like a sort of mass rush to get the aid, and indeed the kind of aid that is being distributed isn't sort of even nutritionally balanced or anything like that. So it's insufficient. It's a flawed operation, and people are dying when they're trying to survive, basically by trying to go get food. And of course, the fact that these sites are not near where people in need are necessarily located. I mean, what happens if you're not able to walk? Elderly, injured, all of these people, children. I mean, the very emblematic case of the child that you mentioned, and indeed other children, who've been killed in and around these sites. I mean, it's like tragedies within tragedies, and we had warned that this was an accident waiting to happen, this operation, and sadly that continues to be the case. It's just not the way to go. And the thing is, there's a perfectly functional solution that could be there, which is the United Nations-led aid operation, which proved its worth in January through to March. We show what we could do in Gaza, we show what we do around the world, and we're just not allowed to do that, and that is entirely unacceptable.
And I want to touch on that, Jonathan, because Cindy McCain was, of course, the head of the World Food Programme, and ironically, she's, of course, the wife of John McCain, who was a famous US senator, and she had mentioned that it's the United Nations that needs to be acting in delivering food and aid to the residents of Gaza, because it goes directly to the affected parties, which are, of course, the residents of Gaza, the victims of this current genocide that is occurring. How important is the United Nations in its delivery of aid, and how is this now being blocked by the GHF, which seemingly seems to be the only party that is delivering aid, and of course, I'm going to say this again, doing it with a weapon on the other hand?
Precisely. I mean, the weaponization of aid, both in the literal sense that you've mentioned, but also in the figurative sense of kind of using it as a like a weapon of war by depriving people of aid. I mean, all of that is incredibly problematic. But indeed, I mean, the system, the way international operations are supposed to work, and the way the UN system works, it's a complex, highly complex humanitarian operations, and the point is to give the aid to the people that need it. And to do that, we have to be allowed to do it. Now that includes all partners being able to bring aid in. Now, UNRWA remains banned from bringing in aid, even though we have 6,000 trucks in Jordan and Egypt that could truckloads, which could just come in, very fast, if we were permitted to do that. It's about always considering the interests of the population that you're trying to keep alive and bring humanitarian relief to, and that is clearly not the uppermost thought in the minds of the decision makers who are using these restrictions as a weapon of war. And deprivation of, deliberate starvation is a war crime. I mean, there's no doubt about that. These things will need to be subject to international investigations, as is forced displacement of populations. All of these things we see, and yet this continues and it continues. But there's been a bit of sort of tweaks around the edges. So some UN agencies have been allowed to bring certain amounts of aid in. But the point is, it's not for a party to the conflict to say, well, this agency can and this agency can't. The point is there are mandates given by the international community in the shape of the United Nations General Assembly, which say how this is meant to work. And it's not a pick and mix.
Jonathan, as we speak right now, of course, with the delivery of aid, with the little bit that is going in, I want to bring in what we saw just yesterday. The attack on the Nasser hospital, the killing of journalists. I know we haven't spoken in a very long time, Jonathan. But where are we now in terms of Israel's complete violation of the law? Because if there's no aid that's coming in, when you've got media workers that are being attacked, when you have, of course, refugee camps that continue to be bombed, and when you have hospitals which are housing many of the displaced citizens of Gaza at this very moment, where are we in terms of that? Because it just seems as if we can have these discussions, but if there's no action that is happening on the ground, especially for many of the UNRWA workers who you just said are starving just like all of the Gaza residents, it really begs belief, doesn't it, as to when we are going to see some sort of accountability phase in all of this?
Accountability has to come. I mean, over and over in this war, we've seen breaches of international humanitarian law. I mean, there is no doubt about that. You know, these are subject to ongoing investigations by various international international legal entities. There will be future investigations, no doubt about that. Accountability has to come. Now, you've rightly flagged. You know, we've over and over we've seen these tragedies like what happened with the hospital, the killing of journalists. You know, the Gaza Strip is the deadliest place in the world to be a journalist, as it is the deadliest place in the world to be a humanitarian aid worker. That really has to raise questions. Why is this happening over and over and over? Now we've seen bombardments, airstrikes around United Nations facilities. For example, UNRWA schools that have been transformed into emergency shelters for displaced people. These are all protected sites, and people have died within our walls while seeking protection under the United Nations flag. Hospitals, medical facilities, all of these things are meant to be protected under international humanitarian law. Now, you know, over and over and over, we see these tragedies. And you almost sense in some ways that, you know, some people around the world have become numbed to this. So yes, we're talking now about the Nasser hospital. The risk is, of course, that, you know, tomorrow, next week, we will be talking about something similar. This just seems incessant, and it has to stop. It has to stop, and change has to come, and it has to come immediately.
Jonathan, I've got 1.5 minutes for you. One thing we keep speaking about, I mean, the last time I spoke to you, ceasefire. Seems to be nothing happening when it comes to that. Hamas has, of course, submitted its proposal. They say they've agreed upon it. The United States is looked at as probably the party that can bring a total end to it. I don't want to discuss politics, but my word, don't we really need it right now for that complete aid to enter Gaza?
We absolutely do. I mean, during the January to March ceasefire, you know, aid was able to flow in at something close to the scale required. That shows what can be done during a ceasefire. A ceasefire has to happen immediately in the interest of the survival of the population, their long-term future. I mean, it seems, you know, talking about the future decades, but every day that goes by without a ceasefire, without, you know, the guns falling silent, is another day lost, and another, you know, day for a lost generation.
Jonathan, always a pleasure having you on. Thank you so much for joining us.
Thank you.
That's Jonathan Fowler, is the spokesperson for the United Nations Refugee Works Agency. After the break, yesterday we had Santaco. Today we're going to be having the South African Meter Taxi and E-Hailing Association. There are changes that are happening there, but also we're going to be discussing the current impasse between themselves and Santaco. My guest is Sibongiseni Shange, the chairperson of that organization. Do stay tuned.